Hello and welcome to today's program. This is Migori Central SDA YouTube channel, and this is Manukato, where there is fragrance of grace. On today's program is health segment, and I am joined by a beautiful lady, and she's going to educate us on drug and substance abuse. In case you're watching us for the first time, kindly find time to watch the previous episode, episode 1, where we discussed about risky behaviors. We learned that risky behaviors are those behaviors that harm us. And we also learned that they begin in the mind. And there was one beautiful thing that really came out that said, not everything that is common is safe, and not everything that feels good is right. So choose wisely, because your future depends on it. Before I introduce this beautiful lady, who is our guest today, I would want us to believe and pray. Our Father and our God, who art in heaven, we thank you so much for this opportunity that you've granted unto us to share your word. Lord Father, may you soften our hearts and give us good listening skills. Let all that we are going to learn in today's show draw us closer and teach us how to live in this world. Let your will be done, for this is our prayer by faith in Jesus' name.
Amen.
Yes, my dear guest, this is the opportunity to introduce yourself.
Thank you, Emma, and thank you for hosting me once again today.
Welcome.
Dear viewers, you're welcome. And today we're going to talk about drug and substance abuse. One of those things we learned last week is one of the risks that we would take is taking drugs or abusing any other substance that we have. So in today, as we begin, we're going to begin with definition of terms. One, we're going to talk about what a drug is. So basically, a drug is any substance that we take that influences our central nervous system. It may have physical and mental effects, and drugs are classified into two. One is legal, and the second one is illegal. For us to say a drug is a legal one, these are drugs that are solely prescribed by authorized medical practitioners, and most of the time, you can only get them over the counter through prescription. The second word we are going to learn today is drug use. So what do we say when we talk about drug use? So drug use is taking any psychoactive substance that would help you or would harm you in any way, depending on how you're going to take it. So when we talk about drug use, we have 4 stages. The first stage is when you say it is drug-free or non-use period. So basically, if you've never used a drug or you are using the drug for any disease, but you have stopped, we say it's a non-use period, or we call it a drug-free period. The other stage that we have is experimental use. So this can be scientific, where a drug is being experimented on a few subjects, or it can be you as an individual trying out on a new drug just to find out how it will affect you or how good you will feel while using it. The third stage is what we call recreational use. So this one is also individual, where you decide you want to take alcohol to have fun. You want to take any other substance that we have there in the market just to get some thrill. And then the last one, we call it the harmful use. We are having 2 classes. One is misuse, and the other one is dependence. Talking about misuse or drug misuse, this is where you are using the drug against the rules or the directions that was given by your medical practitioner. Either the dosage, the frequency, or the timeline that you're given to use it as indicated in your prescription. The other thing that we have is the dependence. So when do we say someone is dependent? Or when do we say that this person is now dependent on a certain drug? So for you to pass as someone that is dependent on a drug, there are few terms that we are going to talk about. You must qualify or you must experience any of the 3 of the terms we are going to talk about. One of them is tolerance. So when you talk about tolerance, basically we mean the dose that you used to take to get the effect that you're getting is now little. So basically, you have to increase the amount. If you're told that you take Panadol 500 milligrams and your headache would go away, so now if you take the same Panadol, you didn't feel any difference. So basically it means you'll now go for 1 gram or 1.5. That is what we call tolerance. The other way of describing dependency is when you start having withdrawal syndromes. Basically, this one means you've been taking the drug for a while, and when you try to stop it, then you start suffering more than when you're taking that drug. That basically means then you're already dependent on that drug. Some of those signs and symptoms that we'll see is you see them having tremors, having convulsions, having cold shakes. When you touch their hands, you find that they are very cold. And some of them sweat very much. And you definitely know this one is missing out on something. This one wants something. You've seen those people that taken alcohol for the first time. The next morning, they'll look very miserable. That is one of those things that we say, it's a withdrawal syndrome. The other thing that will make you qualify to be a dependent of a substance, of a drug, is taking more than was expected. For example, if you would take drug for 3 days, you prescribed for Panadol for 3 days, but now you want to take it for a longer period, 10 days, 20 days, you want to take it every day, then that one shows that you're already dependent on that drug. Then the other thing is when you try to stop using that drug, you find yourself that you're not able to stop. However much your mind, you feel that this drug is doing harm to me, I need to stop it. I've used this alcohol for so long, I really need to stop it. But the next thing, you find yourself with a bottle on top of the table. That means you're already dependent on that substance or on that drug. And then the other thing that we talk about is now it is making you to avoid the social things that you used to do. You start alienating yourself from the friends that you used to have. You start having different kind of friends that are already using the same thing, because the ones that you used to have before are no longer giving you that happiness that you do. That one tells you that you're already dependent on that substance and something needs to be done.
Thank you so much, my guest. My dear viewer, we are taking a break. And after the break, we are going to learn more about substance and drug abuse. Don't go away, just stay right there. My dear viewer, I am glad that you still tuned into this channel. This is Manukato, where there is fragrance of grace. And on today's show, we are still on health segment, and we are discussing about drug and substance abuse. My guest, kindly tell us more about drug abuse.
Thank you, Emma. Before the break, we talked about a few terms. That was drug use, drug misuse, and substance dependence. So now we are going to talk about drug abuse. So what is drug abuse? So when you talk about drug abuse, basically this means that you are intentionally using drugs that are either prescribed or not prescribed more than the intended period or more than the dose that was intended. And I've said that it may be a drug that you're prescribed for in the hospital by a medical practitioner, or just a substance that you've been using before. Now, how do we abuse drugs? One, we have when you take it too much. You've been told that for you to get healed of this infection that you have, you're going to take a Panadol for 3 days. But now that you become dependent, now you start getting you want to get more of the effect that the Panadol or whatever drug you're using is giving you. Now you want to take it more. You're supposed to be taking 500 milligrams 3 times in a day. Now you're going to start taking 1,000 milligrams 3 times a day or 4 times a day. Basically, that is what we call too much. You are increasing the dosage than was intended for. The second way that we abuse drug is too often. You are told take it 3 times a day. Now you start taking it 4 times a day. You start taking it 6 times a day. That is abuse. The third way that we abuse drug is too long. You are told this medication only needs to go for 3 days, or antibiotics only needs to go for 7 days. But because you started feeling a good thing, you started feeling nice when you take it, now you want to go for a month, for an year, using the same medicine. That one is going against the prescription by your medical practitioner. That is one is going against the prescription that you're given or agreed upon earlier. The other way that we abuse the drugs is wrong use. We have drugs that are meant for diabetic patients. And one of them that is commonly abused is called Ozempic. Ideally, it's supposed to be given to a diabetic patient. But people have found out that one of its function, one of its effects in the body is losing weight. So they've started using it for weight loss. Really? Ideally, yes. Ideally, it wasn't meant for weight loss, but now, because it's an effect, they feel it's a good side effect. So you'll find ladies that are not contented with their body sizes start using Ozempic to lose weight. That is not what it was meant for. So that is what we call wrong usage. One of the side effects of Pt1 that we commonly use in our hospitals is sleep. So someone have it or use it because of its side effect. But it was not meant for so. It is an antihistamine. The other way that you abuse drugs is wrong combination. So most of the time you find that you're sick, you go to a hospital, you're given medication, but you don't tell the doctor or whoever is prescribing the medicine that you're also on other substances, which ideally should be something that you must disclose. Some of the drugs that we have really interact with each other that will be very fatal unto your health. So, for example, you go to a hospital and you're given a depressant. Meanwhile, back at home, you're also taking other depressant. You're given benzodiazepine. It's a depressant. It's a treatment, a drug used for treating anxiety. Then you go back home and take alcohol. So you're combining 2 depressants. You can imagine the kind of overload you're giving your heart. Most of the time you find these guys just dead because they had a cardiac arrest. You're given a stimuli and you go get another stimuli. You can imagine how much hype your heart is going through. That one easily causes cardiac arrest.
Thank you so much for that insight. Actually, I have been wondering, you have talked about too much, too little, too often, and also wrong usage. So my dear viewer back at home, have you also been caught up in the mess like myself? If you have, then kindly think of undoing that which you have been doing, especially those who feel that today I'm very tired and I really need to take Pt1. Remember that you will just be using Pt1 and abusing that particular drug. Remember, you will be doing self-prescription, which is not right, and you may end up losing your life. My guest, kindly tell us on the predisposing factors that come along with drug and substance abuse.
Thank you, Emma. Before we do the predisposing factors, there's one more thing that I want to add. There's this drug that we're so much used to using. When you feel headache, you go for Panadol. When you have a little pain, you go for Panadol. It's one of those drugs that we use rampantly. But one thing that we may not know, it is one of those drugs that are very dangerous. And when you take too much, you take Panadol for too long or overdosage, then you put yourself in a risk of getting acute liver failure. One of the most dangerous drugs that people overlook because they think it is harmless. As we continue, we've talked about what drug abuse is. Now, how do we administer these drugs? How do we get these drugs in our bodies? One way is smoking or inhaling. We know the kind of drugs that we usually inhale or we smoke. We have the cigarettes that are all over. You can light it or use it when the light is facing outside, and use it when the light itself is in your mouth. I used to see my grandmother having a cigarette that the light is in the mouth instead of it being outside. But currently I see that people are smoking with the light outside. So you can imagine the kind of harm that we are putting ourselves in. We also have those that we are inhaling, just breathing in the content of what we have as a steam, as a smoke, so that you can feel that high, that thrill that you want to do. The second way is snorting or sniffing. Basically, that is when you use your nose. You would put it on a surface, and then you'd close one side of your nose and breathe in so that it gets into your lungs directly. The other way that we have is ingesting. You eat it as food. We've known that drugs are smoked, but now we have drugs that have been turned into food, where you simply get someone eating, you think they are eating healthy, yet they're taking drugs. That is how dangerous it has become for parents and guardians out there. The other way is injecting. And most of the time, this one we do intravenous, where this drug is injected directly to the vein. So once it's in the vein, it's in the whole body, and you start feeling the effects almost immediately. Then there's these ones that have come in that we are applying them topically. You can apply them on your skin or in the mucous membrane. That is your mouth, your vagina, and the anus. Then there are those that use a combination of those ways. You can have someone that is ingesting, that is eating it, and inhaling at the same time. Or you can have one that is applying topically and injecting at the same time. And then we also have people that move from one to the other because of the threats that they are missing. Either the one that they used to sniff is no longer making them feel high, so they want the injectable ones.
Okay, my guest, I have a question for you, and also to my viewer. Those who have children in high school and also in colleges, you may think that you're safe or your children are safe from it. But again, from what we have just learned, we have noticed that they may be abusing drugs when we are right with them. For example, something that has really taken me aback is the one that they administer using the mucus. It was just the other day that I was reading in the newspapers how these high school children and college students currently are using alcohol. They dip it in cotton wool, that is for boys, and they administer it through their anus. And ladies, they soak the tampon in vodka and they administer it down there. Kindly parents, let us take time to check our children. I know for a very long time in our homes, we've never had these talks of substance and drug abuse. It is now with us, and it is right inside our houses and in our living rooms. Kindly let us take time to talk to them about the effects, and also even to check the items that they usually use. Because you've heard that currently they can even ingest. You may find that someone is eating maybe biscuits, yet they're laced with drugs. Thank you so much for that insight.
Thank you, Emma. And the market is aware that the parents and the guardians know what alcohol looks like. The market is aware, the producers are aware that if you get some of those illicit brews or drinks, they smell very bad. So one of those things that they've decided is to use things like vodka that do not have that bad scent. So it easily pass your child taking a glass of juice and it has vodka inside. You start wondering when you see them change their behaviors, and you would swear that my child is a very good one. I've only seen them taking juice, taking cookies, taking coffee, and I've never seen them using alcohol. My dear parents, my dear viewer, these things are all laced. So you need to be very, very careful with the youths that we are having in our houses, because they know, you know how a packet of cigarette looks like. They know, you know how a bottle of vodka looks like. So when it comes in a lollipop, it comes in a drink that is strawberry scented, you never know.
I am glad that you have tuned in all along into our show. See you next week, because we still have much more on drug and substance abuse. Thank you.